Okay, thank you, Brian, I think you're going to enjoy this presentation because there's only one way this is going to go now, really, isn't there? But thank you very much. I'm no stand-up comedian, failed or otherwise. I am English, like Bruce, and Leslie's name begins with L, so she clearly is from the Northwest. So I'm hoping that starts us on a good footing, but I'm delighted to start just by describing to you some of the work that Big White Wall is doing and the way that it's transforming the way mental health services are delivered by helping people to take control and self-manage and manage their own mental health and well-being. And then I'm delighted that Leslie's here with me, because what Leslie's then going to do is talk very specifically about the way that we're working in Filed and Wire, and some of the early data that's coming out of there, and where we will be taking that next, really. So, but let's just start with a little bit of context around mental ill health. 1 in 4 of us is affected by poor mental health. And I'm not going to ask people to raise hands in the room because we all know there's still a huge stigma around mental health. But let's be under no illusion. It means that a lot of us in this room have been affected at some point by mental illness or poor mental health. And without a shadow of a doubt, every single one of us in this room knows somebody fairly close to us who has been. So this affects us all. Some amazing statistics here about the fact the World Health Organization says that depression will be the second leading cause of disability by 2020, the cost in the UK, and that awful statistic that people with poor mental health, and this is really poor mental health, die between 15 and 20 years earlier than people with good mental health. And this isn't from suicide or mental health related conditions, this is from related physical health conditions. 1 in 3 GP appointments, which I'm sure Chris or any other GPs in the room would testify to, actually are as a result of mental health issues. But this is the one that I want to focus on, which is why Big White Wall exists. 75% of people with mild to moderate anxiety, depression, mental health problems are receiving no treatment at all. And if this was cancer, if this was diabetes, if this was other similar physical health conditions, there would be an outcry. But there isn't an outcry because, well, you fill in the blank, possibly because of the stigma around this still. Now, a proportion of that 75% of people do get better on their own. However, a significant proportion of them get worse, use a lot of resources, and this has a huge significant knock-on impact. So it's undeniable that traditional healthcare models are not working for this group of people, which is where Big White Wall came in. And just a little bit of background, Big White Wall was started by a lady by the name of Jen Hyatt, who's still the chief executive, in 2007. We have contracts in the UK that cover 27% now of the UK adult population, several in the Northwest, in all 4 NHS England regions. We've had over 28,000 members. And what Big White Wall is an end-to-end platform for mental health and well-being. And I'm going to attempt to show you a short film, a 2-minute film now, that describes what Big White Wall is. Okay, so that's what Big White Wall is. This is some of the transformation that Big White Wall is bringing. Traditional models of care say that we travel to appointments, we have to wait for those appointments often. When you're offering this kind of support through someone's phone, tablet, PC, it's available 24 hours a day, 7 days a week. It's there for you at 2 o'clock in the morning if you need it, and it's available wherever you are. So it's available from your smartphone on the bus if that's when you want to access it. I think often traditional health services, we can feel very isolated and part of a bigger system that can be very difficult to navigate. And what Big White Wall is helping people to do is feel part of a community of other people who have shared experiences and therefore feel much more accompanied on your health journey as a result of using it. Also, the health system often addresses one part of us at the time. It addresses our diabetes separately from our depression. But often there's a complex link between these conditions, and we are one person. We are one health person and social person. So what Big White Wall enables people to do is really manage physical health, mental health, social health and well-being all in one place. and much less disjointed. Often there's these one-size-fits-all generic treatments as well. You know, you have diabetes, therefore you fall into this particular care pathway regardless of who you are and what your other experiences are. And what Big White Wall does is give people much more choice of personalised programmes. And, you know, I've worked in mental health services for a long, long time, and we talk about putting people at the centre of their care. But the reality of it is our systems are so big and our professional training is such that it's very difficult to do that. And when you provide something digital, I've really seen how you give people a space online, somewhere you can go and connect with others. That's what it means to be personalised, because you then use that in the way that you choose to use it, how often, when you bring in clinicians, when you want to bring in clinicians. And waiting for an expert opinion and your next appointment, and you know, going to your GP who is the font of all knowledge and has all the answers. Well, this is actually about having access to information all the time, and having access to professionals when you need it. So all in all, that's taking a system where you might feel passive and alone to one where you feel much more active and supported in your own health journey. So I've just got one more slide, and then I'll hand over to Lesley to talk about the filed and wire experience. But these are some of the outcomes. So I've said we've had over 28,000 people use it now. You saw these statistics in that film. 73% of people tell us they have shared an experience for the first time ever on Big White Wall. This is prevention. This is early intervention. This is what happens when you give people somewhere where they feel safe, and are anonymous and able to share that. People open up. 95% of people said they felt better. The Barcelona experience I found very interesting, because we ask our members, what do you feel the well-being gain has been? I don't think we use the term well-being gain, but how has Big White Wall helped you? And overwhelmingly, in most of the areas we work, reduced isolation, it's always over 50% of people say, as a result of Big White Wall, I feel less isolated, I feel less socially isolated. And 80% of people say, I've used this to self-manage my own mental health and well-being now. There is evidence around the cost saving elsewhere in the system, so the return on investment argument is really, really strong. So I will hand over.
Hi, my name's Lesley Tiffen, and I work for Wire and Filed Clinical Commissioning Group. Now, the difference from certainly other presentations this morning when we were talking about China and the number of and the population there trying to provide care to, we are looking at a completely different picture in Filed and Wire. We have a population of around 151,000 people, and it's across a patch of coast and countryside. The majority of our people do live in urban towns, and we have a number of little towns, but actually we have enormous amount of people living in rural villages as well, and therefore access to services is quite difficult. It's estimated by the Adult Psychiatric Morbidity Study that within Filed and Wire we have about 17,000 people who will have depression or an anxiety disorder. And going with the national target, so the National Improving Access to Psychological Therapies target set by the government, we need to reach about 15% of those 17,000. So within Filed and Wire CCG, we're looking at, for the next year, we need to provide interventions to around 2,600. Now, I think that's a minimum number of people that we should be providing interventions for. We know we've got 17,000, and they should be able to access a service. Oh, sorry. Now, you said you're not very good. I'm even worse. It's quite comical that I'm standing here talking about digital solutions when I don't really understand Twitter. So, within Filed and Wire, improving mental health is an absolute priority for our CCG. And in our 2030 vision, we said, and we set our stall out to say we will improve access to psychological therapies, and we'll do that in an innovative way, and we will make sure that access suits our population, that it's available when they want it and within their own homes. And what we found was Big White Wall, which gave us the answer to meet our vision. What Big White Wall enables us to do is support self-care for mental health. People can access it, as Nicky said, at any time. So if you can't sleep at night, you can go onto Big White Wall and access self-guided support if you want. You can go and join a community that's online. It's moving away from that traditional belief that actually to access a community and to reduce isolation, you need to enter a centre. Actually, you can do that electronically from your own home, and for us that's really positive. It offers a real choice, not just in time, but you can access courses that work at your own pace. So whereas traditionally we've said, this is your condition, this is the therapy we will offer you, and you will come here on this time and on this date. Actually, the person can lead that themselves. They can decide which courses they want to access. They can decide when they do that, whether that be at night, whether that be in the day, or whether that be after work, which is a really important thing for us. As Nicky said, accessing this way, nobody necessarily knows you're accessing services. So this whole stigma that stops a lot of people accessing mental health services is removed. You can access without anyone else knowing. Okay, so that's why we did it, and Big White Wall has met our need, but actually have people accessed it? We thought it was the right thing to do, but is it the right thing to do? And actually we can see that 342 people across Fylde and Wyre have already accessed, which we are really, really pleased about. And 42% of those are self-referrals. So they found it themselves and they've accessed the service. Quite impressively for us is that 52% has actually come from GP referrals. And one of the benefits of Big White Wall is that it can be used as a prescription. So GPs can actually meet a need and sign somebody up there and then. And that's been really popular within our area. The softer outcomes, and I would describe this as the so what. You've commissioned a service, you've got 300 and odd people coming in, so what? Has it made a difference? Has it improved the emotional health and well-being of our population? And actually, yes, it has. And one of the things that I particularly like as a commissioner is we can see that impact. It is measurable. We can, from a value for money purposes, you can see the money you're putting in and the direct impact that's had and the improvement in outcomes. And the data is readily available for us commissioners. It's reported monthly, and I find that as a really useful tool to show what we're achieving. And we have achieved 48% reduced isolation, 57% have shared something for the first time, and most importantly, 86% have increased well-being. So that is really, really positive for us. So where are we going next? We need to improve. I think one of the most valuable things on a targets perspective, and unfortunately as a CCG we are governed by targets as well as outcomes. We need to be demonstrating for our government targets that we are improving access to improved access to psychological therapies, both at step 2 and step 3. And now we can count people accessing Big White Wall at each of those steps within our overall targets, and that's really important. Big White Wall is one of a suite of interventions we've commissioned. So we have a main health provider providing therapies. We also have therapies offered by individual counsellors in some of our GP surgeries, and we also have this, because choice to us is really, really important. We want people to be able to decide what they need and where to access that service. We want to bring all of that together so we can see across Fylde and Wyre what is working, what are people accessing, which interventions are having the best outcomes and are being utilised the most. So we really want, in this year, to pull all that data together and really to understand what works. Specifically, an example of that is we know nationally the outcome data for recovery on IAP for Big White Wall is at 58%. That's really good. Our local provider of health services at the moment is about 38%. So we know that for recovery, this is really working. What we want to get to is why, and how can we share that learning with our other providers and across our other provision. We need to make sure we've got robust pathways. So if a person accesses counselling within a GP surgery and there is a wait, that surgery can signpost on to Big White Wall. And likewise, our very large provider, if they know somebody is going to have to wait for an intervention, actually they should be able to refer in and support somebody to access one of the other providers and one of the other provision. And again, it's that mixture of choice around one-to-one, face-to-face, group work, or in the comfort of your own home. That's what's important for us. And most importantly, I guess it's communicating that. So our major drive this year is to communicate that choice across Fylde and Wyre, and ultimately achieve much more than our 15% access target to make sure that people can access psychological therapies at a time when they need them. Thank you.